When there is aging, the facial tissues sag, and it leads to a lot of wrinkles and appearance of jowls at the jaw margins, and these are all the sequelae of aging that which gives the typical appearance of a aged person. So facelift is done to reposition all these tissues which have sagged to in its more youthful position, so that the person looks more youthful. Facelift does not make somebody look more beautiful, it just makes them look more younger. So that is the essential aim of doing a facelift surgery. There are many types of facelifts. If you go through the history of facelift, you can see many types of facelift that have been carried out. Initially, it was mainly the tightening of the skin that was done. So what was done is that the incisions were made at the hairline and also in front of the ear, and then going behind the ear, and the skin was lifted off the facial muscles, and it was pulled tight, and the excess skin was cut off, and wound was stitched. And this would of course make difference to the how the person looked, and did make them look younger. But the drawback was that one could make out that if somebody had undergone facelift, because that would give them a mask like face. So this actually was abandoned, and then more physiological or more anatomical surgery was taught, which is called as SMAS, which is a superficial muscular aponeurotic system, which is essentially the muscles of expressions which are just underneath the skin. So in this surgery, all these muscles were tightened, and that what made the lot of difference, and then people stopped having this mask-like appearance, and then had a more natural, younger look after the surgery. Then after that, people also thought that if they could improve the results, they went into what is called as deep plane facelift, where they actually detached the underlying attachments of the SMAS and then did the facelift, and this gave better results. Now this is the gold standard of the facelift surgery, and all the results are compared with this type of facelift. And there have been a few other innovations to sort of suit different types of problems people face. This facelift can be done by endoscopy, where the incisions are minimal, and people have also done what is called as thread lifts, where only the barbed threads are passed from one side of the face and then anchored at the top to give the desired lift. And these have not been as successful as the surgical facelift, and so they have limited applications. Let's talk about what to expect in the recovery period after facelift. Usually with any surgery, there is always swelling that is associated. So one would have facial swelling, and in somebody who has got more fairer skin, the bruising also would be obvious. If there are any tube drains that have been put in to take out the blood and fluid out of the wound, these tubes usually are taken out a day or two after the surgery. And some doctors also give some medications to reduce this facial swelling and bruising. The stitches are usually taken out 5 to 7 days after surgery. If there is also a blepharoplasty that has been done with the facelift, the eyelid stitches can be taken out on fourth day. But apart from that, the facial stitches are taken out usually between 5th and 7th day after surgery. Now all this swelling and bruising is self-limiting. It doesn't mean that it's going to last forever. Usually the facial swelling and bruising starts subsiding 2 weeks after the surgery, and takes usually about 2 to 3 weeks more for it to subside. And that can happen with or without medication. See, final result is usually apparent 3 months after surgery. So although people are very anxious to know their results and all that, one should not start judging the result of surgery until 3 months are over.